Did you know that heart disease is the leading killer of Americans? Well, a new survey found that only slightly more than half of adults know this fact. An even larger number do not fully understand one of the most common methods for treating the most prevalent form of heart disease, coronary artery disease, or CAD, which can lead to heart attacks. Here now with more on this survey and to set the record straight about heart disease and treatment options for CAD is Dr. Alpesh Shah, an interventional cardiologist with Houston Methodist Hospital. Thank you for joining me today.
Thank you for having me.
Now, Doctor, what are some of the key findings of the survey of adults' basic knowledge about heart disease?
A recently conducted survey by Harris Poll actually taught us some very interesting findings. For example, there is an increasing awareness amongst Americans as to how to prevent heart disease, which is good to know. There's also a good amount of awareness as to how to detect or test for heart disease. But what really surprised me was this fact that there is still lack of awareness when it comes to how to treat heart disease. What are the treatment choices? What are the options available for somebody who already has heart disease?
And what do people need to know about keeping their hearts healthy? Can you tell us what coronary artery disease is and why does it need to be treated?
I'll be glad to. So, look, a heart-healthy lifestyle ought to be the core of what we do every day. Coronary artery disease is where we develop blockages in the heart arteries. This is what causes heart attacks. So it's very important that we are aware of what are risks. Does it run in my family? People who have diabetes, hypertension, high cholesterol, all of them have high risk of heart disease prematurely in their life, and especially if they have any history of smoking. So living heart healthy is such a key, whether it is daily exercise or proper dietary habits, reducing your carb intake and losing that extra weight you may want to. All of this helps us take better care of our heart and in a way prevents coronary artery disease. Coronary artery disease is common, it is increasing, it is even more prevalent in women than it has ever been. So I think we need to be aware and detect it because we live in times today where if we can find it, we can fix it with some of the new technology we have.
Absolutely. Speaking on that technology, can you tell us what treatment options are available that are commonly used for CAD?
Sure. So, in somebody with who's known to have CAD, obviously we'll talk again about heart-healthy lifestyle, as I mentioned, and their physicians will talk to them about medications, whether it's cholesterol-lowering medication or an aspirin, for example, or aggressively treating your diabetes. By the same time, bypass surgery has been available for many years, but what is unique and remarkable about how we can treat coronary artery disease is this technology of stenting. Stent is a metallic tube which we insert through one of the groin arteries or sometimes even the wrist artery, which allows us to open up the blockage, the narrowing in the heart arteries, the coronary arteries. It can be opened up, so that will restore the oxygen and the blood flow to the heart muscle. And what that does in turn, it alleviates a lot of the symptoms, whether it's chest pain or shortness of breath, but also, and equally importantly, prevents or stops a heart attack.
You discussed about how they can be treated. The survey did find that Americans know very little about what you just went over, especially about stents. Can you elaborate on a little more on how they work and the different kinds of stents that people should be aware of?
Sure. So stent technology has advanced a lot. We have been doing a stent for more than a couple of decades now. So just to clarify, it is a minimally invasive surgery. A person usually goes home the next morning. And as I said, we run this catheter from the groin artery or the wrist artery. And over a wire, with the help of a balloon, we have this metallic slotted tube, like a little cylindrical tube, which is propped open where the blockage is. And as it does that, it actually allows that blood and oxygen to flow back to normal. There are several advances in stent. So for example, one of the advances we have made in the last decade is drug coating, because in the older stents, we used to have problems with re-narrowing, but the drug coating allows that re-narrowing not to happen, the scar tissue does not build, and the stent remains open. That being said, we also have learned that there are certain continuing challenges with the healing of that artery. And that's where this new technology, which has been approved in the US for the last 6 months, called Synergy, comes into play. Synergy is probably the pinnacle of what we can offer to our folks today when it comes to stenting. It is made by engineers at Boston Scientific, whom I'm partnering today to convey this message. Synergy stent is very unique. It is ultra thin, it is form fitted, it actually can be delivered to any part of those human coronary arteries. It is drug coated, so it does not have those immediate problems with scarring, but again, very importantly, it has a bioabsorbable polymer. So as the polymer goes away, that allows that artery to heal, and that healing process allows that person to remain heart healthy for months and years to go forward. So that has been one of the most remarkable advances, is introducing this stent technology of Synergy.
That is remarkable indeed. And do you have any advice for people who are concerned about their heart health or feel that they may need to contact their doctor concerning their heart health and heart disease?
Oh, absolutely. Look, this requires a partnership, a proactive partnership between the physician and the person. I think it's very important for a person to identify what is his or her risk. Are they at high risk of getting heart disease, especially prematurely in life? Know your cholesterol levels, know your risk factors, and a physician can educate them. But there are websites. So for example, Boston Scientific has a website which can be very helpful, not only learning about heart disease prevention, but also about this Synergy stent. It is called bostonscientific.com/synergypatient. So if your folks can reach out to their website, they can not only learn about heart disease or coronary artery disease, but also the treatment options such as the Synergy stent.
Thank you so much for that information, Doctor. And for more information on heart disease as well as the latest technology available to ensure your heart health, visit www.bostonscientific.com/synergypatient. Thank you so much, Doctor. It's been a pleasure.
Pleasure is mine. Thank you for having me.